The 74th World Health Assembly closed on Monday with officials stressing the importance of global solidarity as countries around the world keep fighting the pandemic. WHO Director General Tedros Ghebreyesus said that despite the overall decline in the number of cases and deaths, the world remains in a very fragile situation, and no country should assume it is out of the woods yet, no matter its vaccination rate. What solutions did the WHO reach for ending COVID-19 pandemic and preventing the next one? Joining me today via Skype from Nanjing is Professor Zhiwei from the Center for Public Health Research at the Medical School of Nanjing University. And from Beijing, in Goodrum, a senior editor and columnist at China Daily. Dr. Wu, let me go to you first. We've heard from the WHO Director General. He said we're very much encouraged that cases and deaths are declining. But it would be a monumental error for any country to think the danger has passed. What is your sense of where we are in the fight against the COVID-19 pandemic? Do you think it is safe to say that the worst is over yet?
Well, actually, I wouldn't say the worst is over yet, because if we still have countries suffering from this pandemic, then this is not the end. It doesn't necessarily mean that when the virus is going down, then you can loosen up your public health controlling approach, because this is something we have learned in the past, that if you loosen up the public health controlling system, then basically the virus will come back very quickly. And this is a very painful experience, not only in developing countries, but also in the developed country in Europe as well. So, the Director General of WHO is right that we should be should be highly alert on this virus and keeping a close eye on it.
Right, Ian, what were the key messages that you picked up from the WHO Director General and this World Health Organization Assembly that you think the world should really be paying attention to?
Well, I think certainly that we're not through the end of this. I think it would be very foolish to say so. I don't think people in India believe they're through the worst of it. I think they're going through the worst of it right now. It may seem attractive to people in Western nations that have enjoyed an enormous vaccine surplus, an enormous amount of doses being allocated specifically for them while not being shared with the rest of the world. They may be feeling like the worst is over, but the rest of the world is going through a very difficult period. We can't get complacent, and we can't presume that the experience of a few countries represents the entire rest of the planet. The other thing would be, of course, the need for vaccine equity, the need for sharing of these essential drugs, these essential doses that prevent people from getting infected and those who do get infected from developing severe symptoms. Vaccination saves lives, and it's important for every country, not just China, who has been the greatest exporter of vaccines by far, to do their part.
Okay, talking about the vaccine and equitable distribution of vaccines, the WHO Director General, Dr. Tedros Ghebreyesus, has a very important message. Let's listen to what he had to say.
I'm calling on member states to support a massive push to vaccinate at least 10% of the population of every country by September, and a drive to December to achieve our goal of vaccinating at least 30% by the end of the year.
Dr. Wu, where are the areas that countries fall short, and how can we really meet the goals set by the WHO?
Well, in much of the African continent, the vaccination rates are very low. It's way below the 10% the WHO aims for. And also in part of the Southeast Asia countries and the South Americans, some countries are still very low, where the pandemic is still rampage. So that's one of the problems right now those countries are facing, that vaccine shortage. Not only that the vaccines are not available, but also that their logistics systems and the medical system are under constraint in administrating the vaccine. I think this is something actually the industrialized countries could lend a hand and do provide coordinated help and providing sufficient vaccines to vaccinate enough population to cut down the spreading of the pandemic.
Ian, what do you think? Do you think equitable distribution of vaccines, countries helping each other, would be the ultimate test to a global solidarity?
Absolutely. I mean, these are the moments that test those alliances. These put the this is where you put your money where your mouth is, so to speak. And if you talk about an international order that you want to lead, then it's your responsibility to step up in times of crisis. And this is an old figure. It may be even greater than whenever I checked, because this was back in February, but it was estimated that the U.S. as one country, for example, we're not including the European Union in this estimation, if they vaccinated all their population with 2 doses, they would still have, based on their contracts and the doses they've already spoken for, 453 million extra doses as a surplus.
That's more than its population.
Yes, and that's with everyone already having gotten 2 doses. That's extra 453 million doses that would go nowhere because everyone would have already been immunized in the situation. So it's an enormous surplus that needs to be shared.
Professor Wu, how can those vaccines, those extra vaccines, be shared to those countries who are more in need of those? For example, Nepal and, for example, India.
Well, WHO has a program which actually formed in the very beginning of the pandemic. It's the COVAX program. Basically, the purpose of COVAX program is aimed to not only the vaccine distribution, but also the production as well. So the member countries actually signed up to that program. Basically, they need to provide the funds for the vaccine production, distribution, and or administration as well. So one of the problem the COVAX facing is that it has not been able to procure sufficient vaccines to back up its program. So the COVAX actually has a very good mechanism to distribute the vaccine, to make sure that the equal distribution and administration of the vaccine to needy countries. So this is something actually the industrialized countries could do to either donate or basically fulfill their duties to the COVAX program. So that's actually, it's one of the international program or multilateral program which actually would be extremely helpful in fighting against the pandemic.
Right. Guess what? The WHO recognizes that besides fighting the virus itself, countries are out in fighting discrimination and stigma. And that's why the WHO says it's starting to use Greek alphabet to name all the new variants popping up around the world, with 4 variants of concern already identified. WHO says calling variants by the places where they are detected is stigmatizing and discriminatory. Ian, what do you think of this move by the WHO?
Well, it's entirely reasonable. I mean, this is in keeping with the standards that they adopted in, I believe, 2014 or 2015, that stated that viruses and their variants should not be named after places, cultures, animals, to avoid this stigmatization. This is not a new measure. This was a point of contention for some people who wanted to attack the WHO last year, claiming they were, bending to China by not naming it the China virus or something equally stigmatizing. But this is in keeping with their standards, but this was the first major pandemic since those standards were adopted. So it makes perfect sense to use the alpha, beta, so on, to describe these variants, because then you are not associating it with a particular place, and it's easier to say than the more complicated names they'd been using previously. It's only fair. If we don't want if we want COVID to be a neutral name, we shouldn't be using India or the UK or South Africa or another country where a variant was first identified to be associated with this new strain of the virus.
Yeah, obviously we saw the fallout from discrimination and the consequent movement called Stop Asian Hate in America and indeed many parts of the world. Professor Wu, China's role during this whole pandemic is apparently another focus. How do you look at the role of China in alleviating vaccine inequality?
Well, actually, China has been doing a great job. If you look at the China's contribution to the vaccine output, actually, China is one of the largest vaccine producer in the world, and about approximately 40% of the vaccine produced by China actually is either exported to other countries or donated to UN's COVAX program. So China is playing a very critical role in fighting against the pandemic, particularly in the case that when China is in desperate need of vaccinating its own people. Actually, still China providing vaccines by either bilateral agreement or by other mechanism to other countries, or particularly in the developing world. So this is something actually China has been fulfill its duty in terms of the multilateralism in dealing with the pandemic.
Right. At this year's assembly, the U.S. urged the WHO to conduct another COVID-19 source tracing probe. At the same time, some U.S. media brought up this lab leak theory again, although the WHO said that the chances of the virus starting in a lab were quote-unquote extremely unlikely. I want you to listen to what a senior WHO expert had to say about this.
This whole process is being poisoned by politics. And if you expect scientists to do their work, if you expect scientists to collaborate and actually get the answers that you want, actually seek in a non-blame environment to find the origin of the virus so we may all learn how to prevent this happening in future, we would ask that this be done in a depoliticized environment where science and health is the objective of this and not blame and politics. Because quite frankly, over the last number of days, we've seen more and more and more discourse in the media with terribly little actual news or evidence or new material. And this is quite disturbing, quite frankly.
Yeah, that is from Dr. Michael Ryan, Executive Director of the WHO Health Emergencies Program. Ian, how important do you think is tracing the source in preventing another pandemic? And if there will be another source tracing probe, how to really keep it, keep the investigation politics free?
Well, that's going to be very difficult because the well has been thoroughly poisoned by these claims. It may be easy to forget that these were attempted to be surfaced last year. Some reporters in the Washington Post attempted to scare up some evidence of this, and now we have this supposedly new evidence that really is just a rehashing of a State Department fact sheet that was released in January 15th that claims that there were researchers who were sick with what could have been seasonal cold symptoms, which they say in the fact sheet. So let's maybe not get ahead of ourselves in this attempt to pin it on a lab. But this is the problem. This has already been sort of stigmatized and politicized, and it's hard to walk that back. It's pretty much impossible to put the genie back in the bottle, so to speak. So this undermines public health now and in the future, because any investigation of an origin of a virus needs to be absent these political motives in order to find the actual cause. And we forget also that just because there were assumptions about the intermediate hosts, the animal reservoirs of previous viruses, it took a very long time to prove conclusively what the hosts were. So in the absence of that conclusive proof right now, as the work continues, people are taking advantage of that to push their narratives.
Professor Wu, what do you think? Do you have anything to add?
Well, actually, we know that this pandemic was politicized from the very beginning, and the U.S. politicians actually been keen in exploring every possibility for their either personal political gains or their hidden agendas. I mean, this is very clear from the very beginning. I mean, the U.S. actually spearheaded in politicizing the pandemic and created barriers for international coordination. I think that's a true, real problem, and they raised the issues again after the WHO's expert panel concluded their research and investigation. So this is, I don't really know what to say about this. I mean, essentially, you see that it's not the scientists that actually are raising the issues, it's the politicians.
All right, Professor Zhiwei and Ian Goodrum, thank you both so very much.